Dr. Brighten. Okay.
Hey there.
Hey, how's it going?
Good. How about yourself?
Good.
I am trying to situate this. It just occurred to me that I was like, wait, am I going to hold my phone like the entire time I do this? And I was like, wait, I have a little stand. I can try to work out, but I can just stand here. But how are you today?
I'm so good. I have a tripod because I talk with my hands, so I have to be able to set it down somewhere so I can
I do too. I was like, if I'm holding a phone, it's gonna be like this, me being like, yes, I tell you about all these things.
Exactly. So yeah, well, I'm so glad you're here. I've been so excited to talk to you about this because one of the biggest questions I had, we read the book Sweetening the Pill last month. I talked quite a bit about birth control on my Instagram. And one of the questions that so many women had was, okay, so if I don't want to be on hormones, what do I want to do? What's the best, what do I do? And I just thought, I need to bring someone in who does this. And it sounds like this is what you do.
Yeah. And, to answer that question, I think the biggest thing we have to understand is that birth control, that needs to be individualized. There is no one size fits all, and what works for one woman is not going to work for another woman, and it's just really important. I think too often when the contraceptive conversation begins, it's always like, whatever it takes not to get pregnant, and there's so much, so much focus on the threat of pregnancy that we don't get into the nuances of well, what are your genetics, and what are your family history, and what's your experience? Have you used birth control before? And really examining how it affects the individual. And that's the movement and the change we're seeing in women's medicine is no more one size fits all. Women are hip to it, that they need individualized root cause medicine. And as much as we need it for things like Hashimoto's and autoimmune disease and gut disorders and hormone imbalances, we certainly need it in the contraceptive talk as well. And so I always encourage women, make your list of questions, put it in a notebook, meet with your doctor, and then ask them about, those specific things that you want to know about. And then if there's anything else you should know about before you start that contraceptive.
I love that, Kate. So before we dive in too deep, I just want a quick introduction. Who are you? What do you do? How did you get into this?
Yeah, so I'm Dr. Jolene Brighten. I'm a women's hormone expert and a leading authority on post-birth control syndrome, which is the long-term side effects, consequences associated with hormonal birth control that don't just go away because you stop it. And I'm a physician in Portland, Oregon. I'm a naturopathic physician, which means that I'm trained in conventional medicine and alternative medicine. So I help bridge the gap between, both of those worlds so women can understand when do they need a medication, when do they need lifestyle intervention, and how to make it all work for them. And I'm very much all about the root cause business. I did the pill for 10 years. Don't judge anybody for using hormonal birth control. And it was when that's so many of us. But when I came off of it, I lost my period. I developed cystic acne. I thought I was a freak. I thought I was the only one who had these issues. And my doctor, my gynecologist, was very much like, this is not a thing. You always had irregular periods. I'm like, no, I had clockwork 28-day periods before I started the pill. Oh, no. You always had irregular periods. You didn't realize it. You've always had skin symptoms. You just didn't realize it. And at one point, they were like, you've always had PCOS. That's what's going on. And I'm like, and it was confusing. It was very confusing for me because I was like, I was in medical school at the time, and I'm like, I don't fit PCOS. This doesn't make sense. What I'm experiencing is real. And it was gynecologist after gynecologist that was like, no, it's not. And it was once I went into clinical practice. So I actually spent 2 years doing rotations in a homeless youth clinic, which is a lot of birth control prescriptions, as you can imagine. Yeah. And it was when with them, it's like, get them on. And when I was in clinical practice, I had my own private practice, women were coming to me wanting to get off, being in complete hormonal hell and chaos once they did, and having all of these crazy symptoms and being told over and over, this isn't real, this is just in your head. And so that's really, I came up with the term post-birth control syndrome of okay, you came off the birth control. I'm really hoping we get more research, we get more discussion, we get more clinicians involved, and we start to understand what is actually going on here. So I healed myself from post-birth control syndrome It helped heal thousands of other women who, scared to break up with hormonal birth control or couldn't because every time they stopped, it was like acne, mood swings. Yeah, I mean, it really does. It takes a toll on us.
Weird addiction that you would not ever think. Like, I can't get off birth control because every time I do, I'm like, so reading Sweetening the Pill, and I don't know if you've read that, but that's something that she talks about. Like, I found myself addicted to birth control and very scared of getting off of it. Not only, the fertility returning what scared her so much, but then also like that weird fog that you get in coming off of it because you're so used to being on synthetic hormones. And, it takes a while to find equilibrium, and sometimes it doesn't find itself. Like, you need help.
Mm-hmm. Yeah, and I think, Holly's book did so much for really turning up the lights on this conversation. Yeah. And, written from, I believe she's a journalist, like from her perspective as it being her personal journey, and something that I really, have taken issue with, I see on, social media, on the internet, is people actually attacking her and being like, this is fake, you're spreading propaganda. And I'm like, when you're saying that, what you're saying to her is that what she went through wasn't real, is that what she experienced wasn't real. And I think that is one of the most disempowering things that is done in medicine, is telling women that what they're experiencing, because we don't have an ICD-10, that's how we diagnose things. Because we don't have an ICD-10 doesn't mean it doesn't exist. We need a whole lot more humility and curiosity in medicine and an understanding that, like, we may be doctors, but we don't know it all. We may read research studies, but they have limitations too. And the person who's sitting in your office across from you, that woman, her story is real. Her story has power, and she's not lying about her symptoms. She's just asking for a partner and help.
Totally. I love having more curiosity as doctors. I love that, because that's the reality of this. I think, I remember getting on birth control 15 years ago, the attitude was so different. Like, oh, you're having side effects? Well, you need to just toughen up.
Yeah.
What? No, this is really deeply affecting me and my sex life and who I am as a person. And why can't we acknowledge that and start talking about how to fix some of these problems? And that's what I love, that's what you're doing, because that's what we need right now so badly.
Yeah, and we just need to, as doctors, I think we need to give women the information so that they can fully make the best decision for themselves, and then we support them wherever they're at. I have patients who absolutely decide to get a Mirena IUD, who decide that they're going to use the pill, and despite everything they know, this is their choice. And so, what I say, so women who are listening right now, if you're contemplating, you're going to start, you're like, this is the best thing for me, I'm going to say, I don't know your life as well as you do. I don't know what's going on in your life. So this may be the best choice for you right now, but track your symptoms before you start and take note of them as you go through it, because you know how doctors do really well with quantitative data. That means that if you tell me you have a really heavy period, I'm like, what does that even mean? But if you tell me, hey, I was changing a tampon every 3 to 4 hours. I got the copper IUD. Now it's been every 2 hours. 3 months later, now it's every hour. Okay, we've got quantifiable data. This is an issue. And because you tracked it, you can get help so much sooner. And at the same time, there should be lab markers that are being monitored in women who start hormonal birth control. So looking for inflammation, looking for stroke and clot risk,
vitamin deficiencies.
Oh my gosh.
Hypoglycemia. Yeah. And these are all, like you said, quantifiable. You can actually go and say, look, I pulled labs before I started. I pulled labs now. Things are different. Yeah, absolutely.
It happens so often. Like, I had a patient in my practice that she was put on the patch, and then that wasn't working for her. She started the pill. She had a clot scare, so she actually got a DVT. So she got a clot in her calf, and she came to me after her doctor said to her, "Well, none of that worked for you, so why don't you do the NuvaRing?" And I'm like, "Wait, hold up. Was there any discussion about family history, about labs, any of that?" And what we did, we ran her, so I'm so glad she had the sense. So she was like, something ain't right here, I'm not going to do this. And when we ran her labs, we actually found that she had a genetic mutation that predisposed her to a clot, which means that taking an oral contraceptive put her on a 35-fold increased risk of developing a clot. This is a simple blood test run, and given that she had that DVT, it was definitely warranted to look at that. But it's something where I'm like, doctors, slow your roll before you're like, just jump to the next hormone. Figure out what's going on with her, what makes her unique. Because, I mean, I talk to women who have had strokes at 19, and so often doctors are like, oh, the stroke risk is so minimal. It's so minimal, and we don't worry about it. And then you talk to a teenager.
Do you have migraines? Do you have migraines with an aura? Are we having a conversation what auras are like? Because I've talked to people who have been like, wait, is that what that is?
Yeah.
Yes, you should not be on estrogen-based birth control. Totally. It's education, though, and that's why I want to have these conversations, is I want women to go, oh, I need to be asking these questions. Oh, I need to be looking for this stuff. Oh, this is real. You know, it's so important. So
and advocating for yourself. That it's something that I don't subscribe to this doctors are bad or doctors are the enemy at all.
No.
It's that doctors have limitations in terms of their education and the way that they were taught and what's in their toolkit. And if they're continuing, so they go to medical school, tells them that birth control is the best thing that ever happened to women's medicine, and then they go to continuing medical education that dismisses all the studies and dismisses all these things and says none of this is real. That's something that your doctor has some limitations, and so it's nobody gives up a decade of their life and goes into significant debt if they don't want to help people. It's just that if you're getting that kind of interference and that pushback for your doctor, you just might need a second opinion or to talk to somebody else who has a little more experience in this. It doesn't mean that you should just go away, suffer, and just write it off.
No, I absolutely agree, because I'm the same way. Doctors are here for a reason. You want to find a good doctor. And for me, I look at it and go, let's give our money and our support to those good doctors, the ones that are curious, the ones who are willing to dive deeper, the ones that are willing to take the time to talk to you about this stuff. Someone just asked, how do I look for a good care provider? When you go in and have this conversation with them, how they react to what you're saying, that's how you find a good doctor. For me personally, when I go in, I interview before I hire a doctor, and I ask them, how do you feel about this? What do you think about this? And so it's so important to have these types of conversations. And if they write you off, that's not your doctor. Go hire somebody else. And you need to look at it as you're hiring them, So, okay,
I just want to say, though, doctors we know we are not for everyone. And so doctors don't get upset. If they do get upset because you walk away, then whatever, that's their thing. But really, you're forming a relationship. So I know that my in-the-face real talks does not work for every woman. Some women need to have their hands held and to have a different kind of energy, and that's okay.
Yes. Oh, I so agree. And I really, really like someone who's going to be really abrupt with me, very, very blunt, and, say this is how it is. But that, like you said, that's not for everybody, and that's okay. There is a doctor out there for you. Find them, and don't be afraid to interview and find them in the, that process. So what is post-birth control syndrome?
Yeah, so post-birth control syndrome is a syndrome. So what that means is it's a constellation of symptoms. I think the most, one people can understand is irritable bowel syndrome. And so that could be diarrhea, and that could be constipation, or it could be alternating diarrhea with constipation, and there could be cramping and bloating and gas. With post-birth control syndrome, you stop hormonal birth control, and what follows next is the onset of symptoms. Now, some of those symptoms may have come before you started hormonal birth control. Some of them may have started while you were on it. And on average, we see about 6 months, so 4 to 6 months off of hormonal birth control, we'll see the onset of these symptoms. Now, for some women, it can take longer. Some women, it's like they get off of it a week later, they're feeling this. And so some of those symptoms are irregular periods, heavy periods, missing periods. So there's research, there's a small study showing that birth control, how it may protect against endometrial cancer is by down-regulating the estrogen receptors in the endometrial tissue, so the uterine lining. And if that happens, then you can have the estrogen, but it's not stimulating that endometrium. So now you can get pregnant, but you might not be able to maintain a pregnancy, and you may not have your periods come back. And so post-pill amenorrhea is something that is part of post-birth control syndrome. It's been documented since the 70s in research. We've seen this. And so that's part of it. There can also be skin symptoms because hormonal birth control affects your gut, it affects your nutrients, it's affecting your adrenals, your thyroid, so many systems in your body. That's why it can be a little tricky for conventional docs or docs that aren't used to seeing this to understand what's going on. And it's that all of these symptoms come together to be like, okay, what did this hormone do to your body? And so, another big piece of post-birth control syndrome is the effect on the liver. So birth control, if you're using birth control, it has to be processed through your liver. That's where your hormones get processed. All the detox happens there. And hormonal birth control creates a great burden on your liver, which is responsible for helping with nutrients, with helping detox, with helping hormone balance, with helping with blood sugar balance. And so that's why we can really see this constellation of symptoms. And you might have almost all of them, or you might only have a few of them. And so, that's my long-winded way of explaining what post-birth control syndrome is. And what I've seen is that if women don't take necessary steps to heal their body and to undo that damage from hormonal birth control, these symptoms can persist. And that's where you can go on. So PCOS, for example. So my doctors were like, we think you have PCOS. I had pill-induced PCOS-like symptoms where I had the androgen rebound. So my testosterone went up, I got acne, I had a missing period, and all of that was really induced by hormonal birth control. It wasn't a true PCOS, situation. And so if a woman's listening right now and she's like, how do we know the difference? A PCOS woman does not have regular periods from the onset from menarche. So day you start your period, if you had regular periods the entire time, then you come off of hormonal birth control and now suddenly they're super irregular and there's, they're missing altogether. That's not PCOS. Like you didn't have those problems before. And I do have to caveat that if you started your period and then you immediately got on birth control and you're like, yeah, I was having regular bleeds. Well, you were having withdrawal bleeds if you were on the pill. That wasn't a true period. So we can't really understand that. That's where you have to work with a provider. They got to get your data and really understand what's happening for you.
Absolutely. Okay, so let's, and this was one of the biggest questions I had. I had a lot of women who were like, I'm on birth control. I'm starting to realize maybe hormonal birth control is not a good idea. What methods of birth control do you recommend that are not hormonal? Or, I look at the Mirena IUD as a lesser of the evils, in terms of hormonal birth control. What are your recommendations that way? What, should we kind of be looking into?
Yeah, so one thing I'll say is that that's so it's a very common misconception. I'm not shaming you in any way, but Mirena IUD is a progestin, and we understand, so progestin, ladies, is not the same as progesterone, and so often doctors get this confused where they're like, oh yeah, I'm giving her natural progesterone. I'm like, that's progestin. That's not even made the same way. That don't even make sense.
Those are not... It frustrates me because when they talk about it, they will say progesterone often. And you're like, no, it's progestin. Those are not, but that's how cavalier, that's how comfortable it's gotten to where it's like, oh yeah, no, these are just hormones you already have in your body. They're synthetic. That's the reality.
They're totally synthetic, and they're derived differently and they act differently. And we're starting to see more and more research about progestins, breast cancer risk, suicide risk, depression, all of these things. So, when it comes to non-hormonal birth control, we don't have a ton of options, in terms of how many pills and IUDs there are with hormones. But so there's kind of categories here, but one is you can use barrier methods, and everybody eye rolls. Nobody likes when I say use a condom. They're like, that's no fun. I'm like, yeah, I know, but neither are STIs or babies. So, and I have a 5-year-old, and I will tell you right now, it is not always so fun.
A baby that you don't want.
Yeah, totally. Yeah, and if you're not ready to go there, oh my gosh, I can't even imagine. So, there's condoms. There's using there's diaphragm. There's the diaphragm. You can use things like a sponge, which is going to have jumping out of my head right now, spermicide in it. So you can use some of those barrier methods, you can use some of those chemical applications, and then there's also fertility awareness method. So I do want to pause and just say, there is also a copper IUD before I talk about fertility awareness method. And with the copper IUD, there's a lot of lovers and there's a lot of haters. And there's people who are like, copper IUD will make you toxic and it will destroy everything and ruin your life. And then there's other people who are like, I love my copper IUD. It's the best thing ever. And really, this is about what's true for you. And so I have seen in the research, they say, there's localized increased amounts of copper, but not necessarily copper toxicity. But they still say, if you have a copper storage disease issue going on, this is not the best bet for you. So what that says to me is, we're just not quite sure. And for some women, I have seen elevations of copper after having it placed. I have seen some of this dysfunction, this inflammation, these things that women talk about. And for other women, I've seen no issues. We measure their blood. We have them tracking their data. And so I just want to say that about the copper IUD. Now, in 5 years, there might be new research. I might be changing everything I'm saying.
Totally.
And again, that's that humility in medicine to admit that, like, we did the best we could with the research we had, and now we have new research and we can change our mind, which is, I think, awesome. Now, there's also fertility awareness method, and I think every woman should learn fertility awareness method and get the book, Taking Charge of Your Fertility.
Yes.
Yeah, but not just for birth control. Now, I have most of my patients, this is the route they choose to go. And these days, there's femtech like crazy. So there's all kinds of femtech devices out there. So a lot of people are familiar with natural cycles and Daisy, but there's also, there's also Ava. I mean, there's all of these other femtech. But I will say, femtech never replaces your knowledge of your body literacy. So I love leveraging it because I'm lazy and I like that it auto stores it for me. But at the same time, I am checking where's my libido. I'm checking my cervical mucus. I'm checking all of those things, and I'm encouraging my patients. All
cervical
of it.
Position, yes.
Yeah.
If you really want this to work for you, you have to take it seriously and you have to measure these things, because if you don't and you get lazy.
Yeah. Well, and that's how we should start the conversation is every birth control comes with a side effect, and you have to figure out what side effects you're comfortable with. And in my clinical experience, like, quite honestly, women who decide they're going to do fertility awareness method, they are on it. They're like, because they know the risk is pregnancy. Whereas women who are taking the pill are usually taking a back seat. And women don't realize that if you're not using that pill perfectly, same time every day, and not skipping, all these things go into it, it's only about 91% effective. And that's still like a pretty good efficacy rate. But at the same time, this is something my doctor never explained that to me. And it wasn't until I was in the emergency room on the pill, ruptured ovarian cyst, and they were like, we have to check you for ectopic pregnancy. And I was like, I can't be pregnant. I was like 20 something. Like, I can't be pregnant. I'm taking the pill. And they were like, they laughed at me. I remember them laughing at me in the emergency room, being like, no, it's not that effective. And I was like, my doctor said it's like 99% effective. And they were like, yeah, you're like 20 something. Like, tell us again how you're actually taking it. Yeah. But, with fertility awareness method, whether or not you want to make that your contraceptive choice, I really think you should be investing in knowing your body that well, because you have data. You're walking around with data in your body that no lab test or physical exam your doctor can give that to you. And that's where we really have that partnership, that if you come to your doctor and you're like, hey, this is what I'm seeing and this is what's changed, that's providing them data. And that's something, like, I saw a question come up about questions for providers. I would say, making sure that, one, your provider's not going to shame you or make you feel like an idiot because you start fertility awareness method. That really irritates me when doctors are like, oh, so you're going to be irresponsible, or, oh, I'll see you back when you're pregnant. And I'm like, why are you talking to someone like that? That is you're talking down to her. Like, why not have a conversation? And to me, I'm always like, you need a fertility awareness educator. Get with somebody, I may be a doctor, but you need an expert that this is what they do. It's just like, when you want to, you want to start a whole new fitness regimen and you don't know how to do it, you hire that personal trainer. You get that expert who can really help you do that and work with your body. So fertility awareness method, I think it's completely underrated in so many circles. I think it's really powerful to know your body that well. And, we find, the efficacy rates are actually pretty good. Now, all research is flawed. We're humans doing research and we think scientific method and we're perfect. We got to dial it in. All research is flawed. All research has some kind of bias going into it. And we can just own that and be okay with that and keep doing the best we can. But, it's something that critics often come and they say, well, this wasn't an independent study or there was a financial interest, and they don't realize that in the fertility awareness circle, like, who's going to fund these studies? Like, somebody's got to be able to make some money here. And what most people don't, me coming from a research background, I have a better understanding of how often there is a shell at the front, and then what's behind it is actually a pharmaceutical company or somebody with a financial interest and a financial incentive to have this study show a certain thing.
There's no money in natural family planning, like in fertility awareness. I mean, thermometer companies maybe, but
I know, but you buy, like, people are like, oh, it's $300. I'm like, for life. For life. Like, and if you don't have insurance and you've got to pay for your birth control, your pills, your patch, your getting an IUD placed, like, you can look at that, the cost of that. But this is something like, I mean, people often say, like, these thermometer companies are just making so much money, and I'm like, I don't know. If you want to make money, you should design that thermometer to break in 2 years, like, make a woman replace it. Like, they're actually doing some good work there.
Oh yeah, totally. I recommend the same thing. Even fertility awareness, that whole method, even if you've decided, like, I had a Mirena IUD, and I was like, I want to learn more about the fertility awareness method, how to do it. So even with my IUD, I went through the motions of being on that, just so I could learn the rhythm of my body, start observing different, where my cervix was, what my fluid looked like, how things changed, So I recommend that to any woman, anytime, no matter what you're doing, because I think the familiarity is so important. And like you were saying, I was then able to come to my care provider and say, hey, I'm having these symptoms with this going on. And I was tracking that monthly and could see, the cyclical nature of things. And so, I cannot recommend fertility awareness method enough. Even if you're not going to use it as a form of birth control, it's such a great way to track what your body's doing.
Absolutely. And I encourage women to get into a habit. It's a habit. So I encourage them, get into the habit. If you're on hormonal birth control, get into a habit of paying such close attention to your body that if anything shifts or changes, you're on it. You know what's going on and you can observe it. Because too often by the time we get to our doctor, and often in women's medicine, we get dismissed a lot by our doctors, especially, and so hormone issues, pain issues, like, we are dismissed like crazy. And so often by the time we get to our doctors and seeking help, it's like things have been going on for a long time, and a lot of, like, hormonal issues sneak up on you. It's not like one day you wake up and you're like, I'm having the worst PMS ever and super painful cramps. It's like, over time, and you were putting up with stuff and learning to live with it, because women are really, really good at that. But if you're paying really close attention and you're charting and you're looking at these things, like, every patient that comes to my office, I hand them a journal. I'm like, I need you writing down and tracking, and then they're assigned data that I need them tracking to understand how is it, like, what we're doing, how is it affecting you as an individual. And some people will argue, like, we're humans, we're not that different, we're all the same. And I'm like, I've been in medicine, I've been in the health and wellness space for over 20 years now, which is kind of crazy. And, just to see, the trends and the things that go on. And, it's just something that I want more women really honoring their journey and their story and understanding that there's a lot of power in just what you know. And we got, a long time ago, we got sold a bill of goods that, doctor was like God. And as a good girl, you should never question your doctor and you should never question anything. And, so many of us, it happens to us at a really young age where it's like we're 14 and we hear from our doctor that it's not real and what's going on, they can't find a reason for it. Therefore, it's not really going on. And it really plants that seed of doubt that when our 30-something-year-old self, our 40-something-year-old self is like, okay, wait a minute, is this real? I don't know if it's real. Should I go to my doctor? And by the time that you get to our doctor,
trust our bodies.
Yes.
Yeah.
Yeah. Well, and there's a story, like, in women's medicine that goes, like, being a woman is inherently awful and your body's betraying you. And the only way for you to get fixed is for me to give you this pharmaceutical. Now, I'm not a pharmaceutical hater because they have a time and place. And I tell people, I'm like, once upon a time, I was bit by a dog pretty bad. And I was so grateful for IV antibiotics. It's the best thing ever. So they totally have a time and a place. But the reality is that we need to be asking why. So, that's another question question for your medical provider is that if I have symptoms, like what is it going to look like for you? Are you going to investigate it? How do you feel about running labs? Will you ask why with me until we have an answer?
Yep. And I think for me too, is there lifestyle changes that I can do? Is there, is a prescription medication really the end all be all? I have a daughter with type 1. Insulin's it.
Yeah.
And so that's, of course I love the medical field. Of course I love, but even as a doula, same thing. Like, I'm constantly telling women, let's talk to your care provider about why they're making that decision. There's nothing wrong with asking why, and there's nothing wrong with them having to provide that answer. That's just going to help you know your care provider better, And
if your doctor isn't willing, if you ask why, like, why are you recommending this, and your doctor's not willing to give you the explanation or, like, blows you off, not a good fit for you. Maybe a good fit for someone else, but like not a good fit for you. And stay present when you're in that doctor's office. And if your gut is like, they ain't right, or like you feel like your chest tighten, you notice your breath is changing, like you're gripping your hands more, you're sweating, like there's these things coming up that are basically your little intuition saying, I don't think this is the best fit. You need to honor that. And that's something that like totally gets beaten out of us as women, and we get laughed at for having an intuition and listening to our inner voice because it should be all this male yang and always logical. And it's and let's honor the feminine and the intuition and know that nobody knows your body better than you.
Another response that I've seen from a lot of people is, well, we've worked so hard to get to this point with birth control. We've worked so hard to make it so available. We've worked so hard to make it available at the pharmacy. We've worked so hard for all of this. How dare you come back and say, but maybe birth control is bad for you? What do you have to say about that? Because that's some of the flack I've received. And also, I mean, I understand the frustration, especially for some of these women who have seen the generations of work that women have had to do to get to this point. What do you have to say about the very feminist, like, but we worked so hard to get here. How dare you?
Yeah, no, I get a lot of haters, as you could probably imagine. I've been called anti-Margaret Sanger, anti-women, anti-women, anti-feminism, and this is the way I see it. The new feminism, because we need a new feminism, because things are changing. The new feminism is knowing your body so well and being so well informed that you are confident you made the best decision for yourself. And whether that is to take the pill or any other hormone or not, you need to be confident you made the best decision for yourself. And I absolutely agree. Look, I'm a doctor. I'm a first-generation college student. And I look back and I did 10 years on the pill, did not get pregnant. And that absolutely contributed to where I am at today. And on the same note, we have studies that show, and I've acknowledged this on my website, and I always point people back to this. I'm like, did you not read that piece where I was like, look, it has been instrumental in women's movement because we graduated college at a higher rate. So enrollment and graduation rates are higher. We can look at our pay increase. Now, we're not where we need to be with that, but we got paid more with the introduction of the pill. Like, there are definitely things that it's been absolutely instrumental. But millennials, so I'm a Gen X, which is why I'm like, I'm so mouthy and like the way I am. I'm like a Latina Gen X. You better watch out now. But the generation, coming after us, the millennials are rejecting hormonal birth control at the highest rate that we've ever seen. And I've been interviewed a lot of times on this. I was in the New York Post talking about it. And, people reach out to me and they're like, we want to hear from you. Like, why is this? I'm like, because they have seen the generation before them and they have watched, and thank God for these women who went before us and showed us that there's a better way. And they saw the side effects, and they saw the stories that they were told, and they saw the way their doctors were treating them. They saw all of this. And now this generation is deciding that they want better and they deserve better. And this is going to be like, I'm here, you're here, we're shouting from the rooftops, women's medicine's got to change. I really think millennials are going to be like the leading the march. Like, women's medicine isn't going to change because I say it needs to change.